Hi, I'm Dr. Surindher. I'm the Director of Aesthetics Plus Clinics. We got a question from one of our viewers and one of our channel partners who was asking about who is the right candidate for a hair transplant and when should I look for a hair transplant. Do I start when I'm actually losing hair, or should I wait and do the transplant only after I lose the whole head of hair? Well, this is a common question and a lot of people ask us, and my answer to this is no, you should not wait till you have lost all the hair and then go in for a transplant. Looking at normal mathematics, because hair transplant is basically you're redistributing the hair in the safe zone that is in between your ears at the back, and you're redistributing it to the rest of the head. And hair fall is a constant process, especially for men, because that is why it's called male pattern baldness. So it's a constant continuous process which is going on. So what we suggest is when you start noticing balding areas, that is the time that you start to need to do the hair transplant. If you wait till all the hairs have fallen and then you do the transplant, by that time you have already lost a large segment of the hair on your head, and the donor site is again limited. So you cannot replace the whole thing in one go. So we would rather suggest, and since we have to do sittings, we would rather suggest that as soon as you find that you have balding areas, that is the time that you start doing your hair transplant and you start covering those areas. And as subsequently, when you start losing more hair in other areas, then you can come back and do the transplant for those areas. Now, whether we can do the transplant when you are actually thinning, there are two aspects to it. One is the thinning has to be significant so that you can have gaps for us to fill. If you can understand, if there are hairs, you need to put the hairs in between the existing hairs, so then you need the gap. If you have thinning but the gaps are too small, then you're going to be causing more damage to the hairs which are already there. And secondly, because of the trauma, there is something called shock loss, and because of which you lose the hairs which are already present there. So we usually wait till you actually have gaps in between the hair where we can actually transplant, or you have a balding area. Most commonly what happens is these are called the temporal recesses. These are the two sides which actually start balding first, and then the center, and then on the top. So as you can see in the grades of hair loss from grade 5 to grade 7, so usually you can start your transplant where you're in the grade 3, grade 2, grade 3 areas where you have these bald areas, from where you can start the transplant. And as and when you require the remaining areas to be covered, you can come in and get those done. That is the ideal time to do it. What is the ideal age? There is no ideal age to do it. We prefer to do it as and when you feel that yes, it is actually you have bald areas. And the youngest we have done is maybe a 23-year-old, and the oldest we have done is about a 65-year-old. So, and you having diabetes or heart problems or other medical issues should not be a problem, as long as everything is under control. You can go ahead and do the hair transplant. So do not wait till you lose all the hair and then your donor site is very limited, but start doing it when you start noticing actual bald patches on the head, which could be starting usually here, which is the temporal recesses, or it could be starting on the top or at the back, and then you start replacing them as and when you start getting bald.